Welcome back this is segment 2 of 4 of Mental Health Awareness. Um, this is just going to be some quick announcements. As you can see, there is a t-shirt that we have put together, and we discussed completing a wall of honor. So in 2 weeks, after our next staff meeting, we will be having a Jeans Day to help build that wall of honor. We will be giving you more information at the staff meeting 2 weeks from now, but please have $5 ready and a name that you would wish to put on the wall of honor. Second announcement, February 28th is the Mom Race Early Bird registration due date. You can still register after that. The rates go up by $5, I believe. So if you want to save $5, you can register at the Mom Race through February 28th. If you want to pay an extra $5, then do it after February 28th. We do have a team name. Shelly D put together a team called Team Hope. So if you go to register, you can look for Team Hope, H period, O period, P period, E period, and that password is @ which is your shift 2 key for your normal keyboarders. The password is @14, capital MOM 2019. So once again, the password is @14, capital MOM 2019.
Recognizing the spectrum of mental health inclusive of clinically diagnosed and non-clinically diagnosed is beneficial to the treatment of our patients. There is ample research to support the exercise can assist in the improvement of mental health disorders. The present evidence focuses on different types of mental health populations in an attempt to assess the effects of exercise on people which many of which overlap our patient population within rehab services. And just as further clarification, this presentation is not intended to diagnose any of the patients, as that is not within any of our scopes of practice. The objectives: to recognize the clinical population of mental health within our community, to understand that there is potential in the non-clinical populations to be susceptible to depression, to recognize all populations and diagnoses mentioned in this presentation carry potential to benefit from exercise. There may also be other populations that are not covered, which may also benefit from exercise. Listed below are 4 clinical populations that have a tendency for depression. One example of the elderly is the sedentary lifestyles and the hesitancy to participate in physical activities. Studies have been completed to assess the mental health and physical function over a 16-week program involving exercise based on the elderly and assisted living arrangements. Upon completion of the program, it was noted that non-specific depression assessment showed improvements with physical gains and self-esteem. There's also research that demonstrates a positive effect on postpartum, hemodialysis, and cardiovascular patient populations, which all have a tendency for depression. As rehabilitation specialists focusing on movement and quality of life, one can see how large of a spectrum we can assist in a population that will benefit from intervention. In addition to the non-clinically diagnosed, there is also another population that will benefit from rehab intervention. This population involves bipolar, depressive, and schizophrenia disorders. In one study, people with bipolar and depressive disorders have been found to have a positive effective response immediately after exercise. This occurred in a private mental health ward with the focus of exercising twice a week in a group setting. There is also documented positive outcomes in patients with schizophrenia as it pertains to symptomology stabilization. Whether it be inpatient acute care, outpatient orthopedic, neurology-based clinics, or subacute care, as rehab professionals, witnessing mental health depletion is unavoidable. It is our responsibility to recognize that patient outcomes can be improved by acknowledging mental health should be addressed directly or indirectly with each patient serviced. And that concludes our presentation. The following 3 quiz questions will have the answers at the end. Of the listed illnesses, which of the following have documented research that exercise is beneficial? Schizophrenia, bipolar disorder, or depression? People within PT and OT and rec therapy can diagnose mental illnesses. True or false? Which of the following populations may be susceptible to undiagnosed mental health problems? Post-cardiac care, postpartum, elderly, or hemodialysis? The answer number 1 is all. Schizophrenia, bipolar disorders, and depression can all benefit from exercise. Number 2 is false. No, we cannot diagnose mental health disorders. And number 3, the elderly, hemodialysis patients, cardiac patients, and postpartum patients are all susceptible to depressive symptomologies. And here are the references. Thank you once again for taking the time to identify populations to which we can have an impact on.